Hello, everyone. My name is Jordan. My project proposal is on nurse burnout at the Veterans Health Administration. Basically, I'm going to be talking about how burnout affects nurses and patient outcomes and like organizational performance. All right, why this topic matters. So, nurse burnout is an important issue because it impacts not only nurses but also patient care and like healthcare systems as a whole. Burnout contributes to like staffing shortages, lower job satisfaction, and it increases like high turnover rates. So nurses are just constantly coming and going from hospital systems, and most importantly, it's like it affects patient safety and quality and like the outcomes of the patients, the health care they're receiving. It makes it a significant concern for all healthcare organizations, specifically the Veterans Health Administration, because it's one of the largest employers for nurses in the country. Um, what is nurse burnout? Nurse burnout refers to emotional exhaustion, chronic stress. It can lead to compassion fatigue, and it brings a reduced sense of accomplishment when nurses go to work. Over time, constant workplace pressure can cause nurses to leave and cause physical and like mental drainness from going to work. In large hospital organizations like the Veterans Health Administration, this burnout is often intensified due to staffing shortages and increased like patient acuity, right? Like the acuity and the complexity of all of it makes it difficult to resolve. At the Veterans Health Administration, it takes a long time to hire new staff, so that's an additional layer of complexity that happens uniquely at the Veterans Health Administration. Um, so the causes of burnout. So there are several major contributing factors to like nurse burnout. These include staffing shortages, excessive workloads, high patient acuity, mandatory overtime, and workplace stress. So when nurses consistently care for too many complex patients without their adequate support system, like enough staffing or the right resources, it can cause stress to accumulate, and it increases the likelihood of burnout in a department or in the whole Veterans Health Administration as a whole. So, um, burnout and patient harm. So, burnout leads to the increase of these little bullet points. So, it leads to an increase in CLABSI, CAUTIs, patient falls, infections, and it can even lead to malpractice. So, nurse burnout doesn't only affect staff, it basically also directly impacts like the patient's outcome. Research has shown that burnout is associated with like higher rates of central line associated bloodstream infections, which is the CLABSI, and CAUTI is catheter associated urinary tract infections, and patient falls is a constant problem. Infections happen and malpractice happens when there's just too high of a workload for the amount of staff that's scheduled to work. Um, how burnout leads to harm. So, burnout contributes to patient harm because exhausted nurses have difficulty maintaining focus, communicating effectively, or following like best practice that are evidence-based proven to work. The fatigue can contribute to missed sterile techniques, delayed interventions, medication errors, and like reduced monitoring of the patient's overall well-being. And this is how nurse well-being and patient outcomes are closely related. Um, my specific experience was for working for the Veterans Health Administration was working at the VA Long Beach Medical Center. So, a real life story that I have that basically I got to witness all of these organizational problems happen in real time because in my department, in my specific unit, we were actually infamous at VA Long Beach for essentially having the highest rates of CLABSI, CAUTIs, patient falls, infections, and even malpractice where the right dosage of medications weren't given or the incorrect medication was given to the incorrect patient. So these were some of the experiences that I saw in my work, which opened my eyes to the importance of things like these issues being addressed and fixed, so that way only good patient outcomes can come for patients who are sick, specifically veterans, and they can have a positive experience and the desired outcome from their hospitalization. So, why evidence-based practice works? So, um, working at the VA also kind of showed me how evidence-based practice in when being implemented in the healthcare setting can uh, create positive changes. So at first, like many policy changes are felt as inconvenient or difficult to adapt to by the staff. But however, over time, these changes become standard practice and they result in safer care for veterans or for any other patient population. Um, this personal experience reinforced that belief of evidence based practice being implemented into the workplace, and how organizational changes can improve outcomes across an entire healthcare system for the patients and the staff. So my peacock question is, can wellness and staffing support rescue burnout and improve nurse satisfaction over the course of 6 months? So evidence-based practice is it's effective because it uses research and proven interventions to guide clinical decision making, rather than relying on outdated practices that are happening in a healthcare organization. Um, different healthcare systems, both small and large, can implement these policies and through the use of this supported data, create measurable outcomes. Even if small practice changes can make a significant difference in patient safety and nurse well-being, I believe that is important to take steps to make that happen, because the smallest steps will eventually create more positive outcomes. So my proposed intervention is or my pickoff question is, guiding this proposal would ask, among nurses in the Veterans Health Administration and similar hospital systems, like large hospital organization systems, how does a structured wellness and staffing support program compare to current practice and affect burnout and the mental well-being of nurses and job satisfaction over 6 months? So essentially, my question helps to direct the intervention and evaluation process. Um, so implementation of timeline. So the proposed intervention like that I have includes like multiple strategies to address burnout. Essentially, these include access to like long-term mental health counseling, peer support groups, resilience and stress management workshops, and staffing evaluations by upper management to identify unsafe nurse to patient staff ratios in different departments, with the goal to address both emotional well-being and workplace conditions contributing to nurse burnout. So in my proposal, I propose that 6 months would be the time frame from planning to program rollout to evaluating the results of the rollout. So SMART goals. So well, My SMART goals would be to decrease burnout by 20%, increase job satisfaction by 15%, and improve like nurse retention. Um, so the intervention would take about 6 months to completely be implemented and evaluated. Um, on month one would be the focus of um, planning, leadership approval, staff education, and baseline assessments. Month two to month five would be more of like involving and implementing wellness programs and staffing evaluations. And then on month six, we would focus on evaluating and measuring outcomes. Let's see. So expected outcomes is if it's successfully implemented, this intervention would improve nurse well-being. It would lower infection rates and fall rates. It would reduce malpractice. Um, it would improve patient safety. There would be healthier nurses with better mental status, which would be more engaging in their practice, more attentive, and more capable of providing higher quality of care. So, in my conclusion, nurses who are burnt out is a serious issue, and it affects both the healthcare workers and the patient outcomes. So, evidence based practice interventions that focus on mental health and support and safe staffing can improve nurse satisfaction and patient safety. Um, I'm very fortunate for my experience at the Veterans Health Administration because it allows me to help in the future use the knowledge that I've obtained and the experience that I went through to hopefully create evidence-based policy changes once I'm able to move up into a leadership role and hopefully create more positive outcomes across whatever healthcare organization I choose to work for. And these are my references. Thank you for your time.